Hello, everyone, and thank you for attending today's webinar. Before we begin, we would like to cover a few housekeeping items. At the bottom of your audience console are multiple application widgets you can use. You can expand each widget by clicking on the maximize icon at the top right of the widget or by dragging the bottom right corner of the widget panel. Additional materials, including a copy of today's slide deck, are available in the resource list widget, indicated by the green file icon at the bottom of your screen. If you have any questions during the webcast, you can click on the purple Q&A widget at the bottom and submit your questions. You can submit questions anytime throughout the webinar. You do not have to wait to the end of the event. If you have any technical difficulties, please click on the yellow help widget. There's a question mark icon that covers common technical issues. You can also submit technical issues via the Q&A widget. Please note, most technical issues can be resolved by pressing F5 or Command R on Mac to refresh your player console. Finally, an on-demand version of this webcast will be available approximately 1 day after today's webcast using the same audience link to join today's event. The full 508 compliant version of today's slide deck is available on REL Mid-Atlantic website in approximately 2 weeks. Now I'd like to introduce Brian Gill. Brian, you now have the floor.
Thank you, Brian. And thanks to everyone in the audience for joining us today. We're going to talk about new evidence on strategies for reopening schools safely in the fall. As Brian Willis mentioned, I'm Brian Gill. I direct the Mid-Atlantic Regional Educational Laboratory at Mathematica, and I'm joined today by several of my REL Mid-Atlantic colleagues who worked on this project, and also by Adam Schott, who is our partner in the work with the Pennsylvania Department of Education. First, let me give you a little background for those of you who aren't familiar with the work of the regional laboratories. REL Mid-Atlantic is one of 10 regional laboratories across the country, all of which are funded by the Institute of Education Sciences, which is the research arm of the U.S. Department of Education. And the RELs exist to support the research and analytic needs of states, school districts, and other education stakeholders in their regions. We do that by disseminating research findings, by conducting applied research studies, and by providing coaching and technical support on research and analysis to our local stakeholders. All of the work we do is driven by the needs of our local stakeholders. And this particular project started when Adam and colleagues at the Pennsylvania Department of Education came to us and asked if we could provide some research and analytic support for the state's guidance to be provided to local education agencies and entities around Pennsylvania. The question, of course, is the same one that's being faced by schools across the country. In the face of enormous uncertainty with the pandemic raging, how are schools going to reopen in the fall? Pennsylvania, as I said, is faced with the same challenge as every other state. In this regard, there is a recognition in Pennsylvania and across the country that there's a really strong imperative to reopen schools. And you can see this even in the guidance of folks like the American Association of Pediatricians, which has noted that there are enormous harms of schools being closed, as well as potential concerns about reopening. So the question really is how to do this safely. Schools are seeking guidance from Pennsylvania's Department of Education. And so PDE came to us and asked us to do a rapid turnaround project to inform the state's guidance to schools. This was, as far as I know, the fastest project that we've ever done at the REL from start to finish. The matter, as you know, is quite urgent. And even though this was done for Pennsylvania, we think the findings are likely to be relevant to states and schools all over the country. Partly that's because Pennsylvania itself is a fairly diverse state. It has a wide range of different kinds of communities, different kinds of schools, and variations in the COVID-19 infection rates in communities around the state. But also we think it's relevant across the country because there's a sense in which the mathematics of the pandemic are inexorable. That is, every school across the country has to worry about the way in which infection might spread due to the congregation of students and staff together. So before I say a little bit more about what we did here, I just want to pause for a minute and give you all a chance to tell us what your role is. You should have a poll up on your screen now asking you to share what your role or affiliation is as related to plans for school reopening in the fall. I'll pause for a minute to let you fill that out, and then we'll take a look at your responses to see what our audience looks like today. Thanks for taking a minute to respond to that. I'm guessing we have sufficient responses now, so we'll turn to the answers, and it looks like we've got a wide range of different affiliations here, including pretty much every category we had in mind. Educators, school administrators, district administrators, state folks, researchers, and or community level folks. Oh, and a few from public health, and a whole lot in the other category. So again, thank you all for joining us today. So the project that we undertook in collaboration with PDE included three parts. The first was a rapid review of existing and emerging evidence related to the spread of COVID-19, to the susceptibility of children to the disease and their ability to transmit it to others, and also to the educational impacts of remote learning. Second part of the project involved interviews with key stakeholders across Pennsylvania to understand their concerns as related to both health and education with respect to plans for reopening in the fall. And the third task involved conducting simulations using an agent-based computational model to predict the rate of COVID-19 infection spread in schools under a variety of different scenarios and different strategies for mitigating spread, drawing on much of the existing discourse as well as our interviews across the state in terms of the kinds of plans that schools may be considering. So my colleagues Jacob and Danielle are going to talk with you in a minute about the evidence review and stakeholder findings, and then my colleague Ravi is going to talk about the results of from the agent-based model in detail. But first, I'm going to give you all a sneak preview of kind of the bottom line findings, the conclusions we came to as a result of undertaking all three of these tasks. And the biggest point is the one in bold at the top of this slide. Reducing density is likely to allow the safest reopening of schools. More specifically, as many of you probably know, the evidence review found that most children are at relatively low risk from COVID-19 themselves, but they may pose a risk to others when you gather them all together in schools. We also found that there's good evidence that mitigation strategies like physical distance, like masks, like improving ventilation, even meeting outdoors, all of those sorts of things can reduce the spread of infection. But there are really serious questions about the extent to which those kind of strategies can be effectively and faithfully implemented in schools, as Danielle and Jacob will describe, and as probably won't surprise you too much. A third key point is that no matter what approach they take, schools are going to need effective remote learning strategies this fall. There will be some kids at some times, perhaps all kids at some times, who are going to need to learn remotely. And so it's going to be critical to have a strategy in place that allows them to keep learning even when they are not in school buildings. And then finally, and coming back to the headline point here, the agent-based model suggests that the largest reductions in infections come from dividing students into smaller groups, where each group attends school part-time and learns from home part-time. That has the effect of dramatically reducing the roles the school's role in spreading infection, which is good news because it suggests that if smaller groups are coming to school part-time, schools can reopen safely for most students. That is, there will always be some students who are at high risk and who may need to learn from home entirely. But as a general matter, as a policy proposal, it is possible to reopen schools with small groups without dramatically contributing to increases in infection rates in the local community. Very good news there. Nonetheless, the numbers suggest that the safest way to do this is indeed to make sure that the kids are in smaller groups. And Ravi will go into much more detail about those findings. So let me stop there with that teaser, and I will turn it over to Jacob and Danielle to talk in more detail about the evidence review and the interviews with stakeholders.
Thank you so much, Brian. My name is Jacob Hartog, and Danielle, DeLisle, and I, who are both researchers with the REL, will be speaking about some of the lessons we took from a review of the published research, as well as some of the input we got from a series of stakeholder interviews we conducted in conjunction with the Pennsylvania Department of Education. Our evidence review focused on two main aspects of the emerging evidence regarding COVID-19, which is, of course, a rapidly growing and changing literature. This focused on COVID-19 from a public health perspective, as it relates to children in schools. What are the dynamics of transmission, and what are the dynamics of transmission outside schools and in general that have implications for how schools reopen? We also looked at what published evidence can tell us about the effects of school closures, both during the present pandemic and also from previous school closures, as well as the effects of remote learning and how it compares to in-person learning. Our sources included all the range of emerging evidence you might imagine, from peer-reviewed publications and preprints, as well as statements and data from public health authorities, along with the educational research from What Works Clearinghouse, REL publications, and others. Our interviews with stakeholders included interviews both with Pennsylvania Department of Education leadership, with the leadership in local educational agencies, with teachers across the state, with community partners, as well as public health experts and others. Looking at the main takeaways from our review of the research literature, I want to underline what Brian mentioned earlier, which is that the evidence suggests most children are at low risk from COVID-19, but may pose a risk to others when gathered in schools. Most children do not experience serious symptoms, even when infected. The rate of hospitalization for children is much lower than that of adults, even adults. From current epidemiological research, it appears that children do have a lower propensity to contract COVID-19, perhaps on the order of 1/2 as likely as adults to contract or be infected, and slightly, perhaps, lower propensity to transmit COVID-19. But this evidence is unclear and still somewhat controversial. The risks to adults, both at school and at home in contact with children, however, are higher. And this is recognized both within the published research as well as throughout our conversations with Pennsylvania stakeholders. For this reason, we heard from a number of stakeholders that some high-risk staff, as well as vulnerable children, may choose not to come to school. Examining the research evidence on transmission dynamics in general suggests that some mitigation strategies are effective in reducing transmission. These include ones we're all familiar with, such as physical distancing, masks, improving ventilation indoors, as well as meeting outdoors, all of which reduce the chance that respiratory droplets and aerosols from infected persons will travel to uninfected persons. But as mentioned, these are all potentially difficult to implement within a school setting, which we heard from a number of interviews with stakeholders. I'm going to turn it over to Danielle now, and she's going to speak more about some of these challenges and strategies we heard about in trying to implement these in a school setting.
Thanks, Jacob. And as Jacob mentioned, while these strategies may be effective in the community, there are definitely some challenges in implementing them in a school setting. We heard from multiple respondents during our interviews that it would be difficult to implement physical distancing and masking, particularly when working with elementary school students. And while there's evidence that well-ventilated outdoor spaces reduce transmission and could be used for both recreation and instruction, there are challenges considering space availability and the changing weather conditions as we head into the fall and winter months. Another major concern that we heard about is related to transportation. CDC recommends implementing physical distancing on buses with one child on every other bench. And this would drastically reduce ridership, potentially requiring buses to make multiple trips both in the morning and in the afternoon. Many respondents commented that the cost of multiple runs and the increased cleaning could be a challenge, given limited transportation budgets. However, it is possible that some students will continue learning at home if families are comfortable sending students to school, and some families may transport students to school on their own, foregoing the bus system altogether. With the combination of both of these scenarios, ridership might be lower than anticipated, which would make physical distancing on buses a little bit more feasible. One solution we heard is to survey families in the district to gauge their intentions for the coming school year. With a better sense of the number of students that will need to ride the bus to school, districts may be better able to approach this piece of the puzzle. We also heard that there have been many conversations about how to effectively screen both students and staff for infection. The emerging evidence, as Jacob mentioned, shows that children are likely to have mild symptoms or could be asymptomatic. And given this evidence, schools may choose to focus their time and resources on other efforts to reduce transmission, or focus on isolating students that may become symptomatic during the school day, instead of implementing a universal daily screening that may not be very effective. Shifting gears to consider the educational impacts of COVID-19, there is evidence that the spring closures have led to learning losses. Studies estimate that due to the pandemic, the average student could fall 7 months behind academically, with that estimate increasing to 10 months for Black students and 9 months for Hispanic students. While studies show that remote learning is rarely as effective as in-person instruction, as Brian mentioned before, schools will need to be prepared to implement effective learning strategies to accommodate a couple of different scenarios that are likely to come up in the coming school year. First, there are some families and at-risk staff and students that will opt to continue with remote learning for personal reasons, whether school buildings are open or not. Second, many schools are considering some hybrid approaches that include at least some remote instruction on a part-time schedule. And third, schools will need to be prepared to provide remote instruction entirely in the event that there is another temporary closure due to local outbreaks. Teachers will need to implement various strategies to keep students engaged in instructional material from home, which we know can be a challenge. Through our research and conversations with stakeholders, we identified some potential promising strategies for remote instruction. Experts recommend prioritizing real-time synchronous instruction when possible and encouraging ongoing feedback and support for students. Research from blended learning programs also suggests that the most effective programs include individualized content for students and seamless integration of both online and classroom work. We heard that districts and schools could also consider investing in professional learning opportunities so that teachers feel prepared to engage students remotely and also can effectively utilize features and tools on remote learning platforms to complement their teaching and increase student engagement. Finally, many respondents that we spoke to acknowledge the need for social and emotional supports for students and staff as they navigate the isolation and anxiety surrounding COVID-19. To address this, schools can provide a sense of stability and potentially mitigate some of that anxiety by developing and sharing plans and backup plans for the upcoming school year as they become available. Schools also can communicate what supports are available and encourage both staff and families to utilize resources as needed. It will also be very important for teachers and staff to develop relationships with students and families, especially at the beginning of the school year, as students enter a new grade with potentially a new teacher. Alternatively, schools can consider looping students and keeping them with the same teacher as the previous school year when appropriate, to provide a little bit more stability for students as they enter the school year. And that's a brief summary of our findings from the first two parts of our project. There's more information on the emerging evidence, common concerns, and potential strategies to address them in the final memo. But with that, I will turn it over to Ravi to share the highlights from the third part of our project, the agent-based modeling piece.
Thank you, Danielle. I'm going to discuss the results and lessons from the agent-based model simulations. Agent-based models represent a class of computational models for simulating actions and interactions of individuals. The goal of these models is to assess the effects of these interactions on the system as a whole. In our model, the individuals are students, teachers, and administrators. And the interactions consist of students interacting with other students on school buses, students interacting among themselves during lunch and recess, students interacting with classmates as well as the teacher during classes, and finally, the model includes interactions among teachers and administrators, for example, during meetings. And the system we are trying to investigate is a school community as a whole. The figure here depicts part of the school community. Individuals are represented as circles, and the lines denote interactions among individuals. The figure illustrates that students and teachers are grouped into classrooms and have interactions within the classroom. Students can intermix across classes during lunch, and teachers interact among themselves. To assess the effect of individual behavior and their interactions on the spread of COVID-19, as well as strategies to mitigate the spread, we identified and examined 7 reopening scenarios, which were informed by our evidence review and interviews. Scenario A represents business as usual. That is, schools operate as if the pandemic had not occurred. Scenario B represents minimal change to the format of instruction. Masks are worn on school buses and during administrative and teacher meetings, and students eat lunch in the classroom. Scenarios C and D represent changes to instruction. And these are more applicable to settings of where departmentalized learning happens, middle and high schools. So in scenario C, students attend every day, but block scheduling is implemented. While in scenario D, instead of students rotating from classroom to classroom, the students stay in one classroom and the teachers rotate. Scenarios E and F represent now students not attending every day in person. Scenario E is their students are divided into 2 groups, and they're rotating and attending 2 in-person class days a week. So for example, students might be attending Monday and Wednesday, while another group is attending Tuesday and Thursday. Scenario F is also students are divided into 2 groups. And on average, they're also attending 2 days a week, but it's sort of structured a little bit differently. Here, students attend 4 days one week, are off the second week, and attend 4 days the third week, off the fourth week, and attend 4 days on the fifth week. And so that is one group, where a different group attends classes in person on the second, fourth, and sixth week, and so on. And the idea of this scenario is to take advantage of some of the virus's latency period. And finally, scenario G is a further reduction in terms of in-person classes, where students only attend 1 in-person class day per week. We use the simulations to predict how long a school can operate before it sees 5 COVID-19 infections. Why 5 infections? Infected children often have mild or no symptoms, so the first couple infections may be overlooked. With 5 infections, may be also an indicator that schools may want to choose to close temporarily. And the 5 infections represents 5 individuals, students, teachers, or administrators that acquire COVID, regardless of whether they acquired it at school or school buses or outside of the school in the general community. Therefore, school mitigation strategies can reduce infections, but not eliminate them if the disease is in the community. Before presenting model results, I wanted to touch upon a couple of things. We're going to present results for a typical high school in Pennsylvania in terms of number of students and class sizes. However, the specific school results may vary by school size and background community infection rate. Also, I want to note that there's a lot of uncertainty in the literature for some of the parameter values included in the model. In particular, the infectiousness of students and the effectiveness of precautions, such as wearing masks. There is some uncertainty in the literature. Finally, a school may be lucky or unlucky in terms of having random infections coming into the school. So there is also the results will show some level of uncertainty in terms of when actually infections start entering into the school. Therefore, with all of these considerations and caveats, it's important to consider the range of results alongside averages. In the results that we're going to present on the next slide, we conducted 100 simulations for each school level, elementary, middle school, and high school, for the 7 scenarios. And we also conducted 14 sensitivity tests. I'm going to walk through these results shown in the figure here, and which shows the relative time from school start to the 5th infection for high schools. And along the x-axis are the 7 scenarios that I described above, scenarios A through G. The y-axis gives a relative time to 5 infections for each scenario compared to scenario A, which is business as usual. For example, let us focus on the colored bars, in particular, scenario G, where students attend one in-person class a week. On average, if a school implements scenario G, they would have roughly 10 times the number of days before the 5th infection compared to scenario A. Again, business as usual. Scenarios B to D, which include combinations of masks, block scheduling, lunch in classrooms, may reduce infections. But according to the model, they are not reducing it as much as removing the number of contacts that happen throughout the day. That is, not having students attend every day in person. And so now I'm going to talk about the bars around each one of the colored bars, around the averages. The bars around the average show the range of expected outcomes, the 5th percentile to the 95th percentile for each scenario. And so the average effectiveness hides the wide random variation among individual schools, as we sort of touched upon in the previous slide. And as a note, the middle school results are very similar to these high school results in terms of the ordering and the relative magnitude of the different scenarios. And also, these results assume that students remain at home when they're not in person, attending in-person classes. If students instead attend other group childcare settings, this would reduce the impact of scenarios E through G. And in addition, what is not shown, we also investigated relative time to 10 infections. The ordering of the scenarios did not change. However, the relative time for each scenario to 10 infections increased compared to 5 infections. In addition, our sensitivity analyses, our 14 sensitivity tests, did not impact the ordering of these scenarios. The model also produces results indicating whether the transmission occurred in the classroom, lunch, school bus, or faculty meetings, as well as whether the transmission occurred outside the school in the general community. These results are shown by the 7 pie graphs here. Each pie graph represents one of the 7 scenarios, A through G. And I'm just going to walk through a little bit of scenario A, which is shown on the top left. In scenario A, we can see that 32% of transmissions occurred in the general community, that is outside the school. That means the remaining percentage of transmissions occurred within the school. And here we can see it broken down, at least in terms of the model results. 41 happened within the classroom, and several more happened during lunch and on the school bus, and very little happened during faculty meetings. And as we go through scenarios A, B, all the way through G, what I want to focus on is the community piece, so that kind of darker blue color. And as we move from scenario A to scenario G, we see that darker bluer community, the percentage of infections that are coming from the community increases. And finally, under scenarios E, F, and G, over 80% of infections in the school are coming from outside the school, and therefore would have occurred even if school was closed. These results show the relative time from school start to 5th infection for elementary schools. Besides scenario C, block schedule, and scenario D, teachers rotate instead of students within the classroom, which are not applicable to elementary schools in general. The ordering of the scenarios are very similar. Some general findings to sort of wrap up a little bit. The overall transmission rates are lower in elementary schools than in high schools and middle schools due to less student mixing across classes. At all levels, high school, middle school, and elementary school, scenarios E, F, and G minimize the number of infections attributed to school operations. And finally, larger schools, school with larger classrooms, or schools and communities with higher transmission rates will reach 5 or more infections more quickly than those that are smaller, have smaller class sizes, or where the community background is lower. And those are some of the key findings from the agent-based model. And now I will turn it over to Adam to talk a little bit further on next steps.
Thank you, Ravi. As Brian mentioned, I have the privilege of managing research projects between the Department of Education and external partners, including the Mid-Atlantic REL at Mathematica. On behalf of Secretary Rivera, I'm pleased to be on hand this afternoon to outline how the department and the school entities we serve are putting this evidence to use in planning for school reopening. To begin, I want to underscore that evidence has been central to every one of the Secretary's initiatives over the past 6 years. The development of our ESSA state plan began with commissioned research around large-scale assessment, accountability systems, and educator quality. The redesign of our state's system of school improvement drew on a year-long pilot in a purposeful sample of school entities, and then a formative evaluation by our Regional Comprehensive Center. And proposals to improve the performance of our state's virtual charter schools were informed by a multi-year examination of within-school effects on student learning. So whatever the issue, whether that's understanding the strengths and limitations of various initiatives, or developing policy, or allocating financial resources, we've tried to lead with evidence. The test for this project was whether it could be done in the context of responding to a pandemic. I want to note that over the past several years, the REL has found ways to produce very high quality research on a schedule that can inform policy and planning while building PDE's analytic capacity along the way. But for this project, a 6 or 9 month timeline wasn't feasible. The Secretary was clear that we had a moral obligation to provide the field with the best available evidence to make school reopening as safe as possible, and to allow school leaders to credibly represent the risks and the benefits of doing so. And we needed to do that within 5 weeks, as Brian mentioned. As you heard from Jacob and Danielle, over the very short lifespan of this project, we've gathered important but mixed lessons from the reopenings of schools internationally. We've accrued additional evidence that children, and especially young children, are less susceptible to serious harm from COVID-19, while recognizing the effects for staff and older children are of more concern. And we've witnessed real fluctuation in new infections across the Commonwealth, including a steady statewide decline and now a modest increase. For all these reasons, PDE and every state education agency will need to constantly evaluate conditions in partnership with public health experts, consider new evidence, and be prepared to adjust course. And that means no single dispositive round of guidance, no single linear path to school reopening, or for that matter, staying open. But based on the REL's work and its corroboration of key aspects of our preliminary guidance from the spring, we see a range of acceptable options for consideration by school leaders and communities. And so with that as context, I'll spend a couple minutes outlining how the findings from REL's research are being used in Pennsylvania. First, while noting the differential impacts of COVID-19 across the Commonwealth and across the country and the globe, every school entity in Pennsylvania, large, small, urban, suburban, rural, virtual charter, brick and mortar charter, every school entity is responsible for engaging their community in the development of a health and safety plan. The evidence review section of the REL report organizes all of the most recent and relevant research in one place. And that's allowing school leaders to consider how lessons from school reopenings internationally might generalize to their context. It's also allowing them to evaluate health and education considerations in an equity frame, and to justify components of health and safety plans to key stakeholders. Similarly, the evidence-based modeling on the spread of COVID-19, again, reflecting scenarios that were informed both by the literature, but also the professional judgment of our stakeholders, and using the most recently available Pennsylvania data, that information is supporting school leaders in having more concrete discussions with teachers and staff, students and families and others about the relative risk of reopening. Over the past few weeks, we've seen district superintendents and intermediate unit executive directors draw on the modeling to help set expectations in response to community sentiment. And the model results have also helped to underscore that well-conceived part-time attendance is nearly as safe as fully remote instruction. We've been especially heartened to see both district leaders and teachers unions, so both management and labor, using the same data to gather feedback from their stakeholders and to prioritize options for reopening. Finally, as I mentioned, the differential impacts of COVID and then the diversity of the state's education landscape mean that we can't prescribe a single path to reopening. But the results of the modeling have allowed us to fix on what the Secretary has called a North Star of sorts. We think every school entity should be planning to offer at least some in-person education for all students. This should include contemplating a reduction in overall student presence each day, a reduction that could be accomplished through any combination of rotating or split schedules, expanding distance learning, and other measures. The principle is especially important for schools with class sizes and facilities that may preclude 6 feet of separation among students and staff throughout the day. And that would certainly be the expectation in counties under our phased reopening plan that are seeing an uptick in cases. Second, and while not a substitute for reducing student presence on any single day, emphasizing evidence-based hygiene practices and regular deep cleaning and sanitation in alignment with the CDC and our own State Department of Health's recommendations. Third, planning for school reopening should also contemplate the fact that some families may elect to keep their students at home, as well as the prospect of another period of closure. For both of those reasons, reopening should address both making the physical school as safe as possible while building on the distance education programs from this past spring, better supporting students and families in this type of programming, and giving educators more time and training to lead it. As Ravi mentioned, given the random nature of the pandemic, it has to be said that extraordinary efforts associated with the start of the next school year will result in some schools achieving a measure of new normalcy, while other schools with staff who work just as hard and prepare just as well, these schools may realize more significant direct impacts from COVID. The department's commitment to every school community is that we're going to build on this work. We're going to continue to monitor the best available public health and education research and use both in developing timely and appropriate supports. Earlier today, in fact, we issued policy guidance on how school entities across the Commonwealth can meet the state's statutory requirement for a minimum 180-day school year through a mix of both face-to-face and remote instruction. We also published a roadmap for education leaders, an online tool that identifies key procedures for ensuring that systems are flexible and responsive to the needs of students and school communities as more information related to COVID emerges. Reflecting the REL's finding that COVID-related school closures are likely to exacerbate existing equity issues, this framework will support school leaders in operationalizing systems that establish a culture of collective responsibility for the academic, social, and emotional outcomes of all students, especially students of color, students with disabilities, English learners, and students living in the deepest poverty. As a final note, on behalf of Secretary Rivera and the entire team at PDE, thank you to the stakeholders who took time to contribute their voices and judgment to this work, especially related to the scenarios. And a thank you to the incredible team at REL, along with their colleagues at IES, for working so tirelessly to support our community in this work, and especially on the timeline that they were able to do it. And now I will pass it to Brian.
Thanks so much, Adam. So I have added here just a repeat of the bottom line slide showing the general results. I don't think we need to go over that again. And in fact, Adam's comments, I would say, covered it quite well. And so we've got 15 minutes left to address as many of your questions as we can. And many of you, I can see, have already been submitting them. We've got an extensive list in the Q&A function, but go ahead and keep submitting some more questions, and we'll try to address as many as we possibly can here. I'm seeing that we have at least 3 different questions about the assumptions in the model about in the model for scenarios E, F, and G, where we have where the kids are divided into different groups, attending school part-time. What are we assuming on where those kids are on the other days, and in particular, what happens if they are in group childcare settings? As Ravi mentioned, this is an important issue because if the kids are in group childcare on other days, and particularly if those groups are just as big as they would be if they were in classes in schools, then that's going to defeat the purpose of dividing them up. So implicitly, the model assumes that that kids remain at home on days when they are not actively receiving instruction in school buildings. Now, one thing to keep in mind here, though, is that dividing the students into 2 groups, as we have in scenarios E and F, or dividing them into 5 groups, as we have in scenario G, that doesn't mean anything specific about how the kids could be divided. There are a lot of different ways that schools might choose to do this, and in particular, you could certainly imagine scenarios in which they prioritize younger kids who are more likely to not be able to stay at home on their own if their parents have to go to work on days when school is not in session. So I think it's worth, schools are going to want to think creatively about, if you divide up into multiple groups, what's the best way to do that? And it doesn't have to mean that each grade is entirely 50-50 versus having, say, older kids spend perhaps less time, younger kids more time. In any case, the group sizes are important, and districts should not. We've heard of districts, at least in 1 or 2 cases, we've heard reports of districts saying that they're going to offer group childcare to students on other days of the week. It's not clear how that will help in reducing infections unless they can keep those kids in very small groups. This does relate to another question that I've seen already in the chat box about the logistical challenges associated with staggered schedules. Somebody points out that this could be extraordinarily difficult for families with multiple kids who are on different schedules. And I think that just has to be acknowledged, that not having students in school 5 days a week is going to pose very difficult challenges for schools and especially for families. There are no easy answers here, and it's going to be really important to try to come up with creative solutions that can work for the schools and the families while mitigating infection rates. I see we also have at least a couple of questions here asking for more specific information about what group sizes are contemplated in the different scenarios. And I'd like to turn that one over to Ravi, if you are available to respond to that one.
Sure, thank you, Brian. So roughly, so I'll sort of back up a little bit on saying, so what we're looking at in terms of group sizes, that's probably talking about classroom sizes, if I'm understanding correctly. And so that data was pulled on average classroom sizes in Pennsylvania. And in the model, it's a little above from, in terms of the data for fall 2019 to what we're using. We're assuming some students may go and do homeschooling, or some families might choose that. So roughly, it is for K through 12, about 17 students in the classroom, middle school about 19, and high school about 18. So when you go through the different scenarios, A through D, all of them have roughly those numbers. E and F, they're cut in half, so roughly around 10. And then for scenario G, is cut into fifths. So that would be roughly around 4 to 5 students.
Thank you, Ravi. So I think it's fair to say that there's not magic in those particular cutoffs, but that gives you a sense of the sizes that that are likely to be quite effective in reducing the spread of infections. Let's see. We have at least one question about transportation and school buses. And this was an issue that came up in a lot of our interviews. So I'm going to turn to Danielle to talk about what are the implications for getting students to school.
Sure. Thanks, Brian. So in terms of transportation, it does appear to be a very significant challenge kind of across the board of how to do it, how to reduce the number of trips, how to pay for it, how to make sure that transmission is reduced in those environments as well. And through the course of our interviews and some of the things that we've seen, there were a couple of strategies that were proposed to ensure that children remain safe during that transportation phase of getting to and from school. So as I mentioned before, the physical distancing is recommended by the CDC with 1 student per bench on every other bench. And in addition to that, there is the possibility to increase ventilation by having windows open as much as possible. Wearing masks on buses was a fundamental kind of component of our modeling that we would assume that given that there is such significant mixing in that environment compared to some of the other things that we can control in schools, that recommending that students and drivers and aides on buses all wear masks during that time as well. And another strategy that we heard that could also be pretty promising is adopting a strategic student placement plan for students and coordinating pickup locations and reloading students onto buses at the end of the day with a first on, first off kind of approach, where the first student on the bus would go to the very back with the last student sitting at the very front of the bus, so to reduce some of that additional student contact during that phase of transportation to and from school.
Thank you, Danielle. That was a great question, in part because it became clear in both our interviews and our modeling that that the buses are a significant constraint here. In particular, that it's very difficult to meet the sort of recommendations that CDC has proposed without dramatically reducing the number of kids on the bus. And that's one reason that the staggered schedules and part-time attendance can help at least get closer to the CDC guidance about distance on a bus. We also have a question related to testing of teachers and staff for COVID-19 infections. Jacob, would you like to take that one?
Sure. I think that testing is something that a number of our respondents felt was best done in conjunction and in partnership with local public health authorities. They did not feel that schools themselves were, either adequate sites or had adequate capacity to direct testing, although several respondents did suggest that symptomatic children, who would be those who could be infected with COVID-19, but also could be infected with a number of other respiratory viruses or simply were not feeling well in other ways, would, in partnership with local public health authorities, arguably be tested before returning to school. We also examined some emerging evidence that sewage surveillance may be a method of kind of monitoring at a community level or at a school level, whether infections are increasing without the kinds of universal testing methods that might be, impractical for the number of people involved in schools. And in addition, I should say that the CDC currently does not recommend universal testing of students and staff before returning to school. So this will be a kind of emerging topic to watch.
Great, thank you, Jacob. Okay, we have a question about how instruction might work in a staggered context. with somebody starting by noting that research indicates that live remote instruction works best. And I think that is, in fact, consistent with what we found, that having some synchronous component to the remote instruction is likely to be important. So the question is, how would this work in practice if the teacher is alternating student cohorts? Danielle, would you like to take that one?
Sure. So this was something that came up as well in thinking about how, if a school is not operating at full capacity, what it might look like for some additional staff who are choosing to stay home because they themselves are at risk or don't feel comfortable being in a school environment. So there was some conversation about repurposing staff, some of the administrative roles, or having, a teacher who chooses to stay home, potentially paired with someone who is doing the in-person instruction, so that you have someone who's available online for some synchronous components, while there's additionally someone in the classroom teaching the same material to those students that are attending in person on that day.
Thanks, Danielle. This also relates to another question we got, which asked about how will teaching methods be adjusted to suit the new reality, and should the teachers be trained in new methods? It is abundantly clear that there's going to be an enormous need for creativity in implementing any kind of staggered approach to instruction. And even in the non-staggered approaches, the fact that you're going to have some kids, high-risk kids at home, means that there's got to be accommodations for them. There is maybe a potential opportunity, as Danielle pointed out, in the fact that there are some teachers who are high risk and who may need to teach remotely all the time. There may be some way to adjust staffing to help make that work with remote teachers teaching students who are at home, whether they're at home all the time or half the time or some other percentage of the time. But none of this is going to look like instruction as usual. And there will be a need for a lot of effort put into supporting educators in figuring out how to do this well in this new world. All right. I am being told that we have time for one more question. And I can see, I think we got a couple early on related to how generalizable our results are outside of Pennsylvania. So as Ravi mentioned, these models were put together, informed in part by data from Pennsylvania on typical school sizes, typical class sizes, that sort of thing. But in those respects, Pennsylvania, on average, isn't dramatically different from the rest of the country. And as I mentioned at the beginning, the math is inexorable. If you have infections in your community, then you are likely to have them increasing faster when more people are grouped together. So we think these findings are very highly relevant, not just in Pennsylvania, but also in schools across the country. Certainly the evidence we found, the emerging evidence on the spread of COVID-19, the emerging evidence, limited though it is, on remote instruction, is not, none of that evidence is Pennsylvania specific. It is relevant across the country. And even with respect to the interviews, although we spoke to Pennsylvania stakeholders, I firmly believe that the kinds of questions they are raising about reopening are the same kinds of questions that are being posed by educators, by administrators, by policymakers, by parents all over the country. So we very much hope that that this will provide guidance to schools all over the country and around the world even. So we're coming up to the end of our hour. I'd like to finish by thanking you all again for participating and asking if you could, well, first of all, noting, as you can see on the slide here, if you want to see the full results from our memo and all of the details, over 60 or so pages. You can find it at this link here. We will momentarily post a very brief feedback survey. We'd be really grateful if you could take 1 minute to fill it out. Our funders at the U.S. Department of Education will be pleased to know what you got out of this presentation. And I think that is where we will finish. Again, much more information is available in the full memo here. And thanks very much, everyone, for participating.